I'm Cassie Hamilton. I'm a registered nurse working at Mercy Hospital in Coon Rapids, Minnesota. I have worked there for 6 years. Been a nurse for 6 years. That's been my job. Well, you see the patients who don't have insurance then tend to go to the emergency room versus going to the clinic because they don't have insurance, and so they're using the emergency room as their source of primary care, their entry into the healthcare arena. So that does two main things. First of all, usually it means they're seeking care later in their illness, and they're seeking care at a level where it's much more expensive. So if it's not later in their illness, they might be going there for things like sore throats when they should be going to the clinic. So both of these things end up actually increasing the cost of health care and flooding our emergency rooms, which ends up backing up the whole hospital. And so anyway, so basically the whole thing is once they get up to the floor, you're seeing sicker patients because they waited so long to get their care, and they're not getting treatment for their diabetes. So they're not going to the clinic to get their checks for what their blood sugars are, and getting their insulin and taking their insulin because maybe they can't afford their insulin anymore. So now they're coming to the hospital because they have high blood sugars, and it caused kidney damage, or it caused them to have a wound in their foot, and they, so all these kind of things are causing mainly sicker patients, and they're clogging our emergency rooms.